Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Hello everyone, this is Renda Mansour from group number 1. Have you ever heard about GMO? Some of you who's watching this video will say yes I did, while the other will say no I didn't. So let's give you a quick introduction about GMO. GMO or genetic modified organism is any organism that has been produced in the lab through genetic engineering or DNA recombinant. In short, it's any organism that has its DNA changed and altered. That's why it's called transgenic organism. Even though genetic change can happen naturally as a nature and living things evolve and adapt to the environmental change, it takes hundreds to thousands of years for it to happen. This is why the advancement of technology and the new discovery of knowledge, scientists come up with the GMO. Over the past few years, GMO has been used in medical products and food products, and it has been displayed a good reputation ever since. As I have mentioned earlier, GMO has been used in food and medical products. So let's see how GMO helps people in their daily basis. GMO have been helping to produce food faster and at lower cost in order to solve one of the world's major crises, which is food hunger. By increasing the production, we can meet increasing world demand as the human population in the world grows drastically. Lowering the cost can help the poor farmer to work more efficiently because they cannot afford to grow crops in harsh conditions while fighting off pests that keep destroying the plant. Since the GMO crops were invented to fight off pests naturally, the use of complex chemical pesticides were also decreasing. This is the proof where GMO can help in keeping our environment safe from chemical waste pollution. On the other hand, GMO also help in reviving a country's economic state. Back in Argentina, the government gained almost 20.2 million from the agricultural sector since they introduced the GMO crops in the country. Plus, it also creates more job opportunities for the employed. Almost 1 million new jobs were offered in Argentina till 2006, when GMO crops explosion started in the country. From an ethical standpoint, the application of GMO should be weighted with the non-adoption itself. While we eating delicious meals, in India, million people have gone blind and even worse, death, because they suffering from hidden food hunger. There is concern about the toxicity and alteration properties of pest and herbicide resistance gene arrays, as some chemicals might be toxic if consumed in a large amount. Fortunately, scientists found solution, which is by removing the toxic part of the plant and harvesting their crops at low toxin level. Also, the chemicals didn't bring any effect to human health since they are in small amounts and can only be toxic if consumed in a large quantities. Besides, pest resistance and herbicide resistant properties are claimed to cause gene flow, where these genes are being transferred to non-targeted species, such as weeds. Hence, scientists come up with the blending in a distance which can prevent gene flow. Scientists also stated that there are acceptable technologies to control gene flow. Besides, GM food can be improved in its nutritional values. Scientists use gene modification to supply enough nutrients to the poor. For example, the golden rice that helps to solve deficiency in vitamin A and production of edible vaccine. Lastly, GMOs are safe to human health. GMO didn't cause toxicity and allergies. There is not enough data to support any claim that GMO is harmful. So now let's see how GMO products in medical field can help humans' life. GMO should be employed strongly in the medical field as it benefits us in the term of finding a cure for diseases, and it's also a good technique to discover new or unknown diseases. As we all know, cancer is an illness that is fatal and one of the most deadly diseases. For years, researchers have been struggling to find the cure for cancer, but it was unsuccessful. They did manage to come out with some treatment, which is chemotherapy, but it's to have negative side effects. Gene therapy is a product of GMO. Is very helpful in cancer treatment. It lowers the risk of disease transmission, which means the contamination can be prevented. The use of gene therapy is required to reduce the number of deaths and also to lower the suffering that is caused by cancer. Even though there are side effects from this therapy, they are minimal compared to the side effects of chemotherapeutic treatment. Although this issue has been controversial, genetic researchers believe that it helps in finding cure or remedy to diseases. Furthermore, this technology has the capability for disease eradication, and it promises much potential in the medical field, ranging from relieving pills to changing the phenotypes in cosmetology. So, the last point in GMO products in medicine is the good implications of using vaccines and transgenic medicines on humans' health. Most consumers used to hear about GMO products in food, but some of them might be surprised to know that lots of drugs and vaccines that they rely on are the products of GMOs. Vaccine is one of the good choices in the medical field to explain people's opinion on GMO products. Thus, these tools enable scientists to determine the keys to survival of virus by dissecting its DNA, developing new vaccines, producing those vaccines cheaply and quickly, and examining which viruses in the world could become headaches to public health. The required vaccination of children has led to a decrease in the death rate due to preventable diseases. Although people believe that they have the right to determine what is good for them and their children, the interests of society as a whole are important, and the government has the responsibility to ensure that all people in society are safe from preventable diseases. Additionally, with the introduction of transgenic technologies and its usage in many labs around the world, the production and use of genetically modified animals in biomedical, medicinal science, and health testing is growing. Thus, transgenic animals have the ability to fulfill the needs of the pharmaceutical industry, and in coming years, they are looked as potential contributors to the drugs and research in medicine. It is advisable to take vaccination into account because vaccination will make children's lives free from any kind of infectious disease. Labeling GMO products has become ethically concerning. There are 4 ethics principles to follow when labeling GM products, which are autonomy, justice, non-maleficence, and beneficence. Autonomy is the transparency to let the consumer know that the product is GMO, so they can decide whether they to use them or not. Non-maleficence is the assurance that GMO didn't bring any harm to consumer, and beneficence is the benefit that GMO has to offer. While justice is whether the food supply is distributed fairly and at the lowest cost. Clearly, GMO fits all of these requirements, and it's up to the consumer whether to use them or not. The law and the regulation about GMO have been introduced since concerns about this issue arises. The 2 leading countries in GMO, which is Europe and United States, has different view about GMO legislation. The United States is being more lenient with their law, while Europe is stricter. This is because Europe is being cautious when it comes to GMO. The divergence of GMO legislation can be connected when there are policies that need to be followed by every country in importing and exporting GMO products. At the same time, countries can maintain their own legislation that fits their community sensitivity. Achieving this state enables the world to utilize GMO and more parties can be held. To conclude, GMO are safe and have their own ethical values. Each authority from the researchers, producers, and even consumers need to adhere to ethical values. It is the responsibility of all parties. In Malaysia, GMO is controlled by Malaysian Biosafety Act. Research activity on GMO in Malaysia must ensure GMO didn't bring an effect to the environment. National agriculture policy introduced to produce manpower that expert in the GMO field. The National Policy on Biological Diversity launched to ensure the sustainability of Malaysians' own biological resources through biotechnology. The National Biosafety Board is responsible for giving approval of importing GMO to Malaysia after they analyzes every aspect of the GMO to local industry, including the risk and its management. The policies and acts aim to take care of the human, animal, and environment safety. There are some issues about GMO in Malaysia, which are liability, socio-economic, labeling, and traceability, which are concerned. However, if Malaysians are serious about using GMO, eventually it can be solved since these issues are common to many other countries. Hence, there are laws and regulations that should be followed to work with GMO in Malaysia as an assurance of the safety and the balance of every aspect in life.